We all know the importance of first aid and CPR. It's obvious why we need to triage our physical wounds, but what about our emotional ones? Anne-Marie looks at how a local organization is arming the community with the skills to administer mental health first aid.
Here, let me help you. Ready, set, go. Good girl.
When it comes to our kids, their physical well-being is of the utmost importance. We make sure their boo-boos have kisses and Band-Aids. When they're sick, we take them to the doctor.
It might be slippery. Be careful.
It's unthinkable for parents to let a physical ailment go untreated.
You know, if they're bleeding, they need a Band-Aid. If they're crying, they need a hug. Just whatever I can do to physically make them feel better.
But what about the bruises that can't be seen? Well, there's a movement in St. Louis County to arm adults with the power to address these injuries and move past the stigma of mental health concerns.
Mental health first aid is a 12-hour training course, and it's for adults, usually 16 and up, to learn how to work with people who have mental health concerns. You know, we know when people are maybe feeling down or blue and we don't know what to do, and so this is the idea of giving people skills to be able to help.
Chris Mayer is with Behavioral Health Response, a 24-hour crisis call center where individuals in crisis can speak to master-level clinicians and get connected to resources that can help.
If you're concerned about someone who may be struggling with depression, what do you think those signs would be? And what do you think the symptoms would be? And you can get
This year, BHR is funded by the St. Louis County Children's Service Fund to lead 48 mental health first aid classes.
You know, just the visual general sadness appearing. Weight change.
So if you're in the St. Louis County, where you either work in St. Louis County, you live in St. Louis County, or you work with youth in some capacity, you can go to this training for free, but we have 48 that we're doing this year.
Problems with eating or sleeping, that you're sleeping too much.
This course is for anybody to improve listening and responding skills to help those who might have a mental health concern. Mental health first aid is especially important for those who live or work with young people. Addressing emotional concerns early or even before they start can possibly prevent mental health issues as an adult.
It addresses everything. I mean, it's that onset. You look at anxiety is 11, depression is, high school age to college, psychosis is college age. Well, what if we caught it early on, right? So if I can help a 10-year-old or an 8-year-old who's struggling and give them the skills of, I don't know how to cope, I don't know how to speak up for myself, I don't know where to go when I'm having a challenge. Yeah, I think we're going to have adults that are going to be more well-rounded and they'll function better in society. If you went 22 years, if you're 11 and you have anxiety and you go 22 years without getting support, you have a 33-year-old who still hasn't managed their anxiety and is now seeking treatment. How much better could their life have been? And how much more profitable, if you're going to talk about in dollars and cents, would they have been if they had gotten treatment earlier?
Turn around. You want to go back?
Carla Peretz is a mother of 3, and this issue is never far from her mind.
In addition to my daughter, Caroline, who's 4, I have a 7 and a 9-year-old boy, 2 other boys. And so, sometimes the day I can feel like I've got 3 balls in the air and I'm trying to give everybody the attention that they need at the right time. And inevitably, bedtime seems to be when all the problems of the day come up. And I think about that a lot after I lay down myself. Was that a big problem? Was that something that really upset him, or was he trying to buy 5 minutes before he went to bed? And it's a balancing act, and I second guess myself all the time. I want my children to be able to talk to me and more than anything feel comfortable with me so that communication line is open, but I second guess myself all the time that whether or not I've given them enough or solved their problems or have addressed it as a problem.
For more information about mental health first aid, visit 9net.org/health.